Hello, everyone. Welcome to the COVID-19 media briefing. I'm Carrie Schurig, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start with our numbers. We have had 14,100 cases of COVID-19, including 99 cases received yesterday. We have had 250 people who have died from COVID, including 3 that were reported today. A female in her 40s, a man in his 50s, and a man in his 80s, and none of them were vaccinated. We have 68 people reported to be in the hospital today, and 15 of those are in the intensive care unit. And our CDC level of transmission is 381.5 per 100,000. That high threshold is marked at 100, so we're way over that. And our public health folks will talk a little bit more about what that means. We will start with Robin Schurig. She's our public health director, and then we will go to Dr. Karen Ramstrom, who is our health officer, and then our other panelists will also have an opportunity to share some updates. So Robin.
All right, thank you, Carrie. Good afternoon, everyone. Shasta County, like the rest of the state and many parts of the nation and world, is experiencing a surge in COVID cases driven by the Delta variant. I'm going to be sharing the latest data, and I'm also going to provide a bit of an explanation about the data and the differences between different metrics that we're currently tracking and what they mean. I will also share what we all can do to protect ourselves, our families, and the community, and I'll try to clear up some misconceptions that we've been hearing. So we'll start with the cases. The latest data shows that our case rate, in the way that we and the state have been measuring it all along, is 26.35 daily cases per 100,000 population. This is very high and has increased very rapidly, and as I mentioned, is being driven by the Delta variant, which is much more highly contagious than previous strains of COVID. There has been some confusion about whether the Delta variant is COVID or if it's a different disease, so I want to clarify that it is in fact COVID. When someone tests positive for COVID, it is sometimes possible to perform whole genome sequencing of the virus to determine whether it's the original strain of the SARS-CoV-2 virus, which is the virus that causes COVID, or if it's one of many variants or mutations of the virus, which are still SARS-CoV-2, the virus that causes COVID. They're just different versions or variants of that virus. Delta is one such variant, and there are many others, but the Delta variant is more concerning than some of the others because of how highly contagious it is, allowing it to spread quickly before we're able to contain it through isolation of those who've tested positive and quarantine of people exposed to those who've tested positive during their infectious period. Another bit of confusion has come from the fact that the CDC is also reporting a case rate that is different in several ways from how we in the state have been measuring it all these months. So let me try to clear that up as well. The most recent rate from the CDC is 381.5 per 100,000 population. So right off the bat, you can tell that their rate is much higher than ours. And the main reason for that is that we're using a daily average over a 7-day period, while they're using a 7-day total to calculate the rate. So if that was the only difference, you'd be able to multiply our rate by 7 to get their rate, or divide theirs by 7 to get ours. But that doesn't work because that's not the only difference between the two rates. Another difference is that they use the date that the case was reported to public health, while we use something called the episode date, which is the date that someone's symptoms started, or the date they got tested, whichever is earlier. The reason that we and the state use this is because it gives us a better indication of when their infection happened, so how much disease was spreading at that point in time. There's a little more to it than that, but hopefully that helps to clear up why those two rates are so different from one another. What they have in common is that they both tell us that there is a lot of COVID circulating in our community. The CDC considers anything above 100 cases per 100,000 population to be high transmission, and again, with our case rate being at 381.5, it's almost 4 times that threshold. I also wanted to discuss our COVID hospitalizations, and our hospital partners may have more to share on what they're seeing, but in terms of the data, our latest average number of COVID patients in the hospital per day over the last 7 days is 58.9, with 68 in the hospital today, including 15 in the ICU, as Carrie mentioned. Our COVID hospitalizations have increased by about 1.5 times since this time last week, and by about 6 times since this time last month. Our record high number of COVID hospitalizations on any one day was 72 back in mid-December, so you can see that we're approaching that again now. Again, this is due to the Delta variant being so much more contagious that it's able to reach more people, including some who are going to get very sick. And it's also related to the low rate of vaccination in our county. As we've reported previously, the vast majority of our cases, hospitalizations, and deaths have been in people who are unvaccinated, Our latest data on vaccination shows that 42.9% of eligible Shasta County residents, so those age 12 and older, are fully vaccinated, while 9.5% are partially vaccinated, for a total of 52.4 who have had at least one dose of vaccine. This is still very low compared to the state as a whole, as well as the nation. Vaccine remains the most effective way for us to protect ourselves and our families, including those under 12 who aren't yet eligible for vaccine, from COVID and from severe illness or death from COVID. So if you haven't been vaccinated yet, please do so. And if you have questions or concerns, please reach out to your doctor or visit shastaready.org for more information. You can also find information there about how to schedule a vaccine appointment, as well as locations that are accepting walk-ins, including the Reading Senior Center at 2290 Benton Drive, which is open Friday through Sunday from 10 a.m. to 7 p.m., with the exception of 2 to 3 p.m. when they close for lunch. In addition, whether you're vaccinated or not, it's a good idea to layer on other forms of protection, such as masking, avoiding crowds, especially indoors, and staying home if you're sick, except to get tested. For clarification on where masking is required versus recommended, it is required for everyone, regardless of vaccination status, on public transit, in healthcare settings, in adult and senior care facilities, indoors in K-12 schools, childcare, and other youth settings, in state and local correctional facilities and detention centers, and in homeless shelters, emergency shelters, and cooling centers. For those who are unvaccinated, masking is also required in public indoor settings and at work, unless you're alone in a room or vehicle per OSHA standards. Masking is also recommended in these settings, even for those who are vaccinated, and especially if you or a household member are immunocompromised or at high risk for severe illness from COVID, or if a member of your household is not vaccinated. Those are my updates, and I will turn it over to Dr. Ramstrom to share some more.
Good afternoon, everybody. Today, I will be touching on areas of concern and what we want people to know in light of the surge, as well as third dose recommendations for immunocompromised individuals and what we're hearing about booster doses. So first, what do we want people to know in light of the surge? As Robin shared, the surge is driven by the COVID-19 Delta variant virus, which is far more infectious, 200% more infectious than the original Wuhan SARS-CoV-2 virus. In other words, the Delta virus will find people who are not immune, especially people who are unvaccinated. The COVID-19 Delta variant causes the same sort of symptoms as the other variants and as the original SARS-CoV-2 virus. However, some data suggests that the Delta variant may cause more severe illness than previous strains in unvaccinated persons, but this is still being studied. So where are our vulnerabilities? What is most worrisome to us right now? One area is our very busy healthcare system, which I will let our hospital partners address. But the bottom line is we want people to be healthy, stay healthy, and out of the hospital. And we have prevention tools to do that. I hope the comments from our hospital partners will reinforce the unequivocal importance of full vaccination as soon as possible. Another area of vulnerability is our unvaccinated children as they resume school. So why is this different and more concerning than last year? Because of the high transmissibility of the Delta variant, which we are concerned will translate into a greater number of children being exposed than before, which will lead to more infections in children. And even if the Delta variant is no more virulent in children than the original virus was, the sheer numbers will translate into more children being admitted to the hospital. And we can't predict which kids will get severely ill or have lingering symptoms, even if they have mild infection. Of course, we need our children to be in school. We want them there for the many benefits, and we know that our school superintendents are working hard to make it safe for the students. Masking and vaccination when age eligible are key. One important step that families can take to protect their children of all ages, as well as medically vulnerable and older adults, is to ensure that all eligible household members over the age of 12 are vaccinated. The good news is that the COVID-19 vaccines are working very well, especially to prevent severe illness and death, including from the Delta variant. Vaccine breakthrough cases are expected and numbers increase proportionally as vaccine coverage increases. New information is showing that if someone is vaccinated and they do become infected, the viral load drops much faster than in unvaccinated people, reducing the amount of community spread. This is huge and it's very reassuring. So what about vaccinated versus unvaccinated individuals? Statewide, vaccinated individuals are 6 times less likely to be infected, 10 times less likely to be hospitalized, and 16 times less likely to die of COVID-19 than unvaccinated. Also, when breakthrough cases do occur, The overwhelming majority of cases are among adults over 65 or individuals with weakened immune systems, which is a nice segue to talk about additional COVID-19 doses for these vulnerable groups. Late last week, the CDC's Advisory Committee on Immunization Practices recommended people with weakened immune function get a third dose of vaccine, which has been added to the FDA's emergency use authorization for both Pfizer and Moderna mRNA vaccines. The third dose is recommended because these individuals may not have had a strong enough immune response after receiving the initial vaccine series. This is different than booster doses, which address waning immunity, and I'll touch on that in a moment. People with weakened immune function are at higher risk of being hospitalized or dying if they get COVID. And about 40% of vaccinated patients who are hospitalized with breakthrough infections are immunocompromised. CDC provided a list of immunocompromising medical conditions and recommended individuals consult with their doctor about their own clinical situation. The recommendation is to get a third dose of the same vaccine already received, Moderna or Pfizer, which should be given at least 28 days after a second dose. In terms of the Janssen or Johnson & Johnson vaccine, no additional doses are yet approved, though FDA and CDC are working to provide guidance on that issue. Individuals can self-certify that they have an immunocompromising condition. They don't have to provide additional details, and no prescription or other clinical documentation is required for people to get a third dose. Because the immune response of immunocompromised people is not as robust, it's important that these individuals continue other prevention measures even after a third dose. And family members and other close contacts should be fully vaccinated to protect their family members. What about boosters for others? CDC indicated they're evaluating the use of boosters for people whose immunity might have waned in the months since they completed their vaccine series, particularly seniors. About 75% of people hospitalized with vaccine breakthrough cases are over age 65, according to the CDC. Studies are evaluating boosters, and those results are expected soon. And as we've seen in the media, boosters for high-risk groups may be coming in September. While still highly effective at preventing hospitalizations and deaths, studies are emerging that indicate the Delta variant may be impacting the effectiveness of some vaccines, so CDC is looking at that as well. And lastly, because the Delta variant is so contagious and our vaccine coverage isn't great in Shasta County, it's important for all of us to use other prevention measures such as masking and distancing, especially indoors and in public settings or mixed groups. And that's all I had today.
Thank you, Dr. Ramstrom. We will now check in with our healthcare partners and our education professional. Let's start with Mark Mitchelson from Shasta Regional Medical Center.
Thank you, Carrie. Nice to see you guys again. It's been a little bit of time since we got together and talked about this. Really, the biggest things that we wanted to stress was we are very, very busy. Our total census is very high. July and August typically has been the times that our census has been typically lowest of the year, but we really haven't gotten a break. The COVID patients that we have are younger, they're sicker, and they involve a lot more resources that we didn't really see the last time. Of course, in addition to this, all the stress of the fires and partnering with our other hospitals in the area to making sure that they have resources, Trinity, Lassen. So it's been a little tough, but I just want to commend all the healthcare workers that we have and stress to the community that, you know, even though there's a lot of politics going on right now, just support our people. And they're really doing a great job.
Thank you very much, Mark. Let's go over to Robert Folden from Mercy Medical Center.
Hey, good afternoon. So I'll echo what Mark was sharing, and I think we want to kind of take a step back about a year and a half ago when this pandemic started, because we opened up an incident command to help us respond to the disease that we were seeing within the community. And as those volumes ramped up, you know, we had to do things that we hadn't done before. So what's interesting is we sort of reached a steady state, you know, or at least that's kind of what we were referring to it as here in the spring, where COVID hasn't gone away. We haven't closed our incident command all this time. We've still had areas in the hospital where folks are helping to care for patients with COVID like we would for any disease state. But what's a little unique is that here in the last, gosh, it feels like 3-4 weeks, what was an average of about 7-8 patients a day has truly skyrocketed. So it was shocking every Monday to sort of take pause and see that now we were at 13 COVID patients. Now we're at 30 COVID patients. Now we're at 50 COVID patients. And today we're at 54. So to think that this is not real, it's very real. And to Mark's point, it's a little more invasive. It certainly feels like folks are impacted more. We have more folks on ventilators at this time. We're probably providing at least as much respiratory support in general for people who aren't in the ICU. And like we saw last time, we started to see more people of younger age groups, 60s, 50s, 40s, 30s, and we're certainly seeing that now in much larger numbers. So not uncommon to see people in their 30s, 40s, and 50s. I will say that a good 93, 95% of the patients that are here in the hospital with COVID that have had the confirmatory testing were unvaccinated individuals. So when we talk about rates, and we talk about do vaccines make a difference? Vaccines weren't designed to stop disease 100%. They're designed to help our bodies respond if we ever get that disease. And in some cases over time, if we want to look at polio or others, we were able to eradicate disease. But the reality right now is we continue to see disease progression because we don't have enough vaccination. And maybe others will feel more comfortable as the FDA does the full validation or whatnot. But I think the one statistic that I continue, I'm a lab scientist by trade, I'm not a physician, but the one overwhelming statistic that I keep reminding our own staff as we talk through vaccination or not is the fact that 95% of our medical staff is vaccinated. I mean, from day one, there wasn't hesitancy. And I think that speaks volumes, because most of us, we rely on what our healthcare partners tell us. We rely on what our family physicians tell us. And I can't think of too many times when 95% of our medical staff has agreed on any one topic, but certainly this is a time when they have. So with those volumes, absolutely, we are looking at our surgeries every day. And the reason we have to look at our surgical capabilities is because after surgery, many times we need an ICU bed or we need telemetry beds, and we're not able to free up those beds right now because we're caring for COVID patients. We have already opened many of our care units throughout the hospital in order to meet the demand, and we continue to do the surgical procedures we can as volume allows us to do. PPE is much less of an issue now because we've had a year to get our supply chain in order, and I think we're in very good shape here in the North State. I worry, to Mark's point, I will always worry about our staffing. People are working long hours. People are, again, stressed. I think we're all tired of the smoke in the air. That seems to be an unwanted reality here in the summer. But, as Common Spirit Health has put out an expectation that our staff are vaccinated by September 30, that's where we're headed. So we're hopeful. We'll continue to talk with staff. We'll continue to encourage people to get vaccinated. There is an exemption process that folks are working through right now. So we're gonna continue to meet the need of the community. We're gonna continue to talk to staff. I'm hopeful that with some education and in talking through the issue here over the next few weeks, we'll be able to increase our staff vaccination rates. We'll still be here on October 1. That's what I know. And lots of rumors. I would just ask the community, when you hear rumors, the first litmus test is, does this even make sense? And there's lots of rumors out there that I think the average person would have to ask themselves, does that even make sense? And if it doesn't pass that test, there's a 99.9% degree that it's not an accurate rumor.
All right. Thank you very much, Robert, for that update. We will go over to Dean Germano from Shasta Community Health Center.
Good afternoon, and I want to say one thing. Robert, thank you for you guys negotiating a settlement with Anthem Blue Cross, by the way. That was a major stressor in our community, and as you know, amongst my employees especially. So thank you. I'm glad that at least that one is out of the way now, so we can worry about other things. I can echo what Mark and Robert just shared. We are seeing an increase in the number of people coming with symptoms and being tested positive. It is a concern. Staffing is a concern as well with the new mandate that's coming and how some of the staff feel about that. So we're having to work through our exception criteria as the others are working on. I am very concerned that we don't start seeing younger children start to become more of an issue with this virus. I mean, I really am worried about that. If you look at what happened in the southeast of the United States, they're not immune to this thing, and it would be really tragic if we started losing children to this thing or having them go through the real horrors of having to go, through serious hospitalization. So it does worry me, and I know that Judy's on here and she's got all those students coming to school. So I would just say that we are doing everything we can as we normally do. I'm also concerned that our vaccination rate amongst the Medicaid population, who we are very focused on, those on Medi-Cal, the last data I saw from Partnership showed our vaccine eligible group there is only at 28%. That is also a big concern to us who take care of a lot of those folks. So we're doing everything we can to educate, provide information, provide opportunities for vaccinations. I don't think we can test our way out of this problem. We have to get ahead of it with vaccinations. So thank you.
All right. Thank you, Dean. And we'll go to Judy Flores. She's the Superintendent of Schools for Shasta County.
Good afternoon. We have 25 school districts in Shasta County, and 10 of those school districts opened on Monday. 2 others opened on Tuesday. And from those who've opened, the responses from superintendents have been really positive. People have been willing to wear masks. If they didn't happen to show up with one, they were willing to put one on when they arrived. And the other good news is that more are returning from distance learning. We had quite a few families who chose distance learning last year, and the vast majority of those are returning from distance learning to be back in classrooms this year. Some of the challenges that we're facing, both from student perspective as well as from staff, we have people out on quarantine to start the school year. So from a staff perspective, that becomes really challenging because substitutes are almost non-existent right now for teachers or any school staff. So the staffing issue is a real challenge. And you think from a child's perspective, missing the very beginning of the school year and those initial days are challenging. So we do have quite a number of both students and staff out on quarantine. And then we have quite a few staff vacancies. I was talking with one superintendent this morning who said, I've had this position posted all summer, even into last spring, and 0 applications. So it's a huge concern on keeping schools open without being fully staffed, as I know our medical providers experience on a regular basis as well. So I will stop there.
All right, thank you, Judy. We did not leave a ton of time for media questions. I apologize for that, but we did have, it's been a long time since we've met, so we wanted to make sure that we provided lots and lots of information for all of you. Do we have media questions?
Hi, yes, I have 2 really quick questions. This is Jessica, the Record Search Site. Can people request the 3rd shot from their doctor or clinic now, or make an appointment for soon? And also, do we have any idea when people will be able to get a booster in Shasta County, assuming all approvals go through? Just a ballpark.
As far as the 3rd dose, I think all of us as vaccine providers have been kind of getting up and going with that and getting our paperwork in place. And so I know some people have been able to schedule at pharmacies, for example. And so I think those individuals can go ahead and call and get that appointment. And then as Boosters, we are waiting for CDC and FDA to approve. And then once that comes out, whenever that may be, mid-September or perhaps later, we will prepare for that as well. And more than likely, that's going to come out starting with vulnerable groups, perhaps older adults, maybe healthcare workers. We're not really exactly sure yet. So CDC is still working on that.
Thank you.
And we'll keep information updated on Shasta Ready and in our daily updates as those actually do become available. Other media questions?
I've got a question for our hospital friends. You touched on the politics and on the rumors and all that. Can you assure us that the hospitals have capacity for everything now? What is the situation in the hospitals? Both Robert and Mark, if you could answer.
Well, it's a little bit of a loaded question, Mike, because we're both pretty full right now. The reality is both Mark and myself and mayors, quite frankly, all of our hospitals have surge plans available. So when or if we get into a situation where we have so many patients where we've filled every bed in the hospital, we're able to surge into other areas. So I'll just give you a what if. There are times where I might put some beds in an auditorium and care for less critical patients in an auditorium setting rather than an actual patient room. You see that often in natural disasters where part of a facility might be damaged and they have to provide care elsewhere in that facility. So all of us have worked together on those plans. And when those things happen, we're also working with the EMS system to move patients to other facilities.
You haven't reached that point yet, I assume. And then also,
No.
What's the staffing situation with this, the ongoing, people who don't want to be vaccinated?
Staffing's always been an issue. When we started this 17 months ago, it became very difficult to get travelers, right? It changed the whole dynamic of staffing in healthcare. So that continues to be an issue. And, Mike, we still have a month where folks are working through exemptions and whether or not they're going to be vaccinated. So, while we're looking at indicators, we're still quite hopeful.
And I would echo the exact same thing that Robert's saying. We're following the letter of the law of California and encouraging as many vaccinations as we can with staff. And one thing that's different with the current situation that we had the benefit of last time was the state was able to provide state-sponsored travelers to this area last time, and it doesn't look like that's going to be the case this time. So we may need to be a little more creative with our current staff and find different avenues so we can support and have the resources. Doesn't look like the state has the ability to assist at this time.
Hi everyone, this is Daisy, also with KRCR. Just two really quick questions for Mark and Robert. If you guys can kind of touch base on how the increase in COVID hospitalizations are impacting your hospitals. Robert, I know you touched base on this question very briefly. And then maybe what are some of the big changes, I guess, people can expect, again, with these increase in hospitalizations?
I think one of the changes that we have seen over this current setup is the visitor policies that have been sent out by the state. One of those large restrictions that's a new change for all of us is that we are across the entire state only allowed to have visitors that come in that are either show proof of vaccination or a negative COVID test, which is different from last time. So working out that process with staff and visitors, being professional, making sure that everybody understands the why behind it and they understand the expectation before they come into the hospital has been a challenge, but we've been trying to be as proactive as possible to message that out to our people.
Yeah, Mark covered that well, and then I think I'll touch on the flip side because we always kind of talk about the challenges. We still have a lot of people here every day who pour their heart and soul into caring for the community. So, my hat's off to our nurses, our respiratory therapists, our EVS workers, the folks that are in the kitchen. We've got a city taking care of the community. And so again, we've got 10 times the things going right and going well as we do challenges, with staffing being a challenge.
All right.
And then I'm so sorry, just one super, if I can squeeze just one super last question. We also have been hearing some non-emergency procedures are being canceled and or rescheduled because of the increase. I don't know, again, Mark and Robert, I don't know if you guys can touch base on this, and if they are canceled and rescheduled, how long should people kind of expect for this to last? And maybe what kind of procedures are you guys essentially maybe putting on the side right now because of the increase in COVID hospitalizations?
So let's keep this in the context of the pandemic, but it certainly would apply to any other, let's say, natural disaster. When we are as full as we are with our COVID population, we don't have the capacity or the capability to have beds for patients that might otherwise have surgery on one day and need to stay the night. So a very simple example might be, so we start looking at procedures that are more elective in nature or aren't emergent. So they're not the trauma patient. They're not the person that fell off their roof and they have a compound fracture that needs surgery. They're not the people who fell and hit their head and have a severe bleed. We're talking about cases that can be scheduled, like, let's say, maybe a total joint procedure, or there's a litany. But we have a surgical group of physicians that look at our cases every day, and they're typically looking for tomorrow and a few days beyond. And we're trying to do the best we can to say how many ICU beds will we have, so that we can do some of the more serious cases and feel like we have the adequate resources to do so. But it's a day-by-day thing. I'll defer to Dr. Ramstrom and Robin, but the predictions we have is that this current surge may last clear through October, or it may peak in October. We're hopeful that the models overestimate, especially at the rate we're entering this surge.
All right. Thank you, everyone.
Can I ask a question? Can I get one question in? This is David Ben.
Really quick, Dave.
Okay. You talk about the vaccine mandate. This is a question for the hospitals, SRMC and Mercy. The vaccine mandate, is it causing staffing shortages specifically right now?
And I guess it'd be a fairly easy answer. No, it is not. That specific thing is not causing staffing challenges at this point, because we are trying to be as communicative. I don't know if that's the right word. We're trying to have as much discussion as we can with our current staff, knowing that it's a very concerning thing, and just make sure everybody has all the right information. So no, it has not infected staff.
And I agree.
All right. Again, I apologize that we don't have time for additional questions, but if you reach out to me, I can help connect you with the other communications experts in the hospitals and here in the Health and Human Services Agency. I thank you all for your time. Thank you all for staying a few minutes extra. We will try and squeeze it down a little bit more next time so we can have more time for questions. Thank you, everyone. Be sure and watch Shasta Ready for the most current information, and we will let you know when we schedule another update of this nature. Thank you again very much, and we'll be talking with you all soon.